In Medway and Swale, we've got some of the highest levels of deprivation in the UK, and we've got some of the highest levels of premature mortality, particularly in Sheerness. When we started looking at our population health management programme, we wanted to focus on children. We've got 620 children in the Sheppey community that are living in poverty. We've got really high levels of child and young people attendance and admissions to our local acute. We've done several schemes in relation to childhood asthma. We've started working with the local school in Sheerness to help co-design some of their healthy lifestyle intervention programmes within the school.
We have a population health management analytics group where we bring together people from each of the organisations in our local area. We bring together data from a range of different sources, and this helps to provide a complete picture of the health needs and drivers of health within our area.
48% of the island in Sheppey are economically inactive, so that's adult working age, aren't working. 50% of kids here don't have regular attendance at school, so we felt it was really important to actually work with these children to show them that there are different options.
Young people on Sheppey are more likely to struggle with things around their health. There's more chance of them getting things like asthma or struggling with obesity, particularly from a young age. So actually being able to show young people and actively involve them in discussions around their health and what schools, community providers, organisations can do to help facilitate that and support that as well is really important.
We've learned about what's kind of good for certain age groups and what they should be doing and what they should be kind of overall been learning about. At a certain age, like for my age group, we've kind of learned about how we should be like taking care of ourselves, like being a bit more independent, doing chores, just trying to help around the house a bit more.
The data we've analysed from population health management showed that the asthma outcomes were poorest for children in deprived communities. The children in the lesson have learned how the lungs work, they've learned what asthma is, they've learned what could possibly trigger asthma, just to give them some of that healthy lifestyle advice and how that can improve the asthma management for the children as well.
We wanted the voluntary sector as an equal partner around the table, so collaboratively we devised a framework. The framework is a document with a set of outcomes with reach into 1,500 voluntary sector organisations across our community. By using the data, we've been able to target communities that are experiencing the highest inequality, and we've done this through our Health Catalyst programme, through the work that we're doing with the school and through work we're doing with the voluntary sector with the community food bank bus.
We offer people a chance to come on here and to pick items of their choice every week. We have people frequently coming here from the NHS, from domestic abuse. We also have people from the utilities who can help if you're having problems with your utility bills.
On the bus, we offer clinical reviews for children who possibly could have asthma or do have a confirmed diagnosis of asthma. We can offer diagnostics, we can offer prescription changes and just general education for parents and families.
It is a vital part now of the island's structure to have this bus. The voluntary sector needs to be at the table because otherwise I think the NHS would struggle without this support. It's very, very vital for the work of the NHS.
The benefits of participating in the Community Health Catalyst programme is that we put the control into the hands of communities. So we don't go with a set agenda. Communities identify what's important to them and then we work with them to find solutions and ideas that might then respond to their needs that they've identified. The introduction of the VCS framework has given us a pivotal opportunity to formalise the relationship between the sector and statutory bodies and commit to work collaboratively to achieve our shared goals, and that's already achieving tangible outcomes.
We're on a different footprint, we're in a different space. We've started what we've called a community movement, a social movement. This programme will hopefully give children choice.